Good afternoon, everyone. Thank you for tuning in today for the town hall meeting. I'm Allison Copeland. I'm the System Deputy Chief Engagement Officer. Marshall Stewart, our Chief Engagement Officer and Vice Chancellor for MU Extension and Engagement, was unable to join us for today, but I'm glad to be here representing him and fill in as the moderator for this event. Your support and engagement makes such a positive difference in our system, and we appreciate that. Today's town hall is meant to provide you with the opportunity to learn more about the retiree health plans available through the university for 2022. Before we begin, Marcia Stewart, Vice President for the Office of Human Resources, would like to say a few words. So Marcia, please go ahead.
Hey, Allison, thank you. Thank you so much for joining us today. We're pleased that we already have such a good crowd to learn more about your benefits that are being offered for 2022. And before I turn it over to our experts, I wanted to just say a couple of things. First, as you all may remember, HR collaborates with finance and vendors and a host of folks in bringing you your benefits. And there's two people that I want to particularly call out and say thank you to. So we have our Total Rewards Advisory Committee, we call it TRAC, which if you're not familiar with it is made up of staff and faculty and retirees, and they really work with us in helping making decisions around benefits. And I hope they're on, Betsy Garrett and Bob FIFO are two of our retiree representatives that we very much enjoy working with. And we appreciate the expertise and the perspective that they bring and the work that they do for the university in this capacity. Also just wanted to briefly highlight, and of course, much more details to come from Carol and the United Healthcare team, that we did go to a competitive bid process this past year. And I'm pleased to report that United Healthcare did get the bid. And I think folks will be pleased with that. We get good feedback on United Healthcare. And there's some good details. I don't want to spoil all the good news, but there's some good programs and things that they'll go through in more detail with you throughout the program. Finally, I just want to say thank you. Thank you for being engaged and supporting the university as your role of a retiree, whether you're directly involved like Bob and Betsy are, or whether it's just how you speak about the university to your family, your friends, and your community. Just want you to know that we appreciate that, we know that you're still supporting us and helping the university and advocate for the university. So with that, I'll turn it back, I think, to Allison.
That's right. Thank you, Marcia. Appreciate that. I'd also like to offer a special thank you to our 4 campus retiree associations and for their collaboration and support as we prepared for this event. So the Retirees Association groups represent and advocate for the needs and interests of retirees. I encourage you to reach out to your association and engage with your campus retiree group for educational opportunities and for social programs and to stay up to date with university news that matters to you. So now let's move on to our agenda. First, some of our benefit experts will provide presentation on the retiree annual enrollment process and the sponsored retiree health plans for 2022. We received some benefits related questions ahead of time, and our experts that you'll see in a moment will answer some of those questions as they present. We'll get to as many of the other questions as we can during the Q&A portion at the end of the event. So don't forget, we're also taking additional live questions, so make sure that you ask those or put those in the chat. Appreciate that. If you think of a question during the event, feel free to send those questions our way at any time during the town hall through the Q&A function. So with that, I'll introduce our experts. So today, we're happy to welcome David Cinto, Senior Account Executive with United Healthcare as a United Healthcare representative, Medicare Advantage. And then Shannon Gambalvo, Senior Account Manager, again, with United Healthcare, non-Medicare focus. And then last, internally, we have Carol Wilson, who is the Benefits Director with the University of Missouri System. Carol, thank you for being here, and I'll let you get started telling our colleagues about the retiree health plans for 2022.
Carol, I think you're still muted. There you go.
Am I unmute now? Can you hear me now? Okay, great. Thanks, Allison, and welcome everyone. Thank you for joining us today. I'm Carol Wilson, Director of Benefits for System, and I want to give you a few reminders about the retiree annual enrollment period, which runs from October 25th through November 5th this year. During retiree annual enrollment, you can change your medical plans, add or drop vision coverage, or decrease your insurance coverage. To do that, you will need to submit an annual enrollment change form to the university no later than November 5th. You may have already received your university-related insurance information letter in the mail. That letter contains information on your specific plans, premiums, programs that may be of interest to you, as well as actions for submitting plan changes via email, fax, or mail. If you decide that you want to continue with your current enrollment, you don't have to do anything at all. Your current enrollment will roll over to 2022. If you have questions after the town hall ends, or if you need specific support as we get closer to annual enrollment, reach out to our HR Service Center or access our website, and we'll put those links in the chat for you. So before we start talking specifics about our medical plans, I want to mention high-level changes as well as what's staying the same for 2022. UnitedHealthcare will again be the plan administrator for our Medicare Advantage plans in 2022. UnitedHealthcare will also provide our Part D pharmacy services for those plans. David Cinto will provide more information on the specifics later in the town hall. Next, dental, vision, and life insurance will see no plan or premium changes in 2022. But keep in mind, premiums and eligibility for enrollment in life insurance may change due to your age. If you want to learn more about eligibility for these plans, please check out our website. And again, we'll add those links to the chat as well. Okay, so now on to medical plans. As you probably know, there are two sets of sponsored plans, those available to Medicare eligible retirees and their eligible dependents, and those available to non-Medicare eligible retirees and their eligible dependents. David is here to share information about our plans, about our Medicare plans, and information about new programs and updates to current programs that are available to support you. David, I'll turn it over to you.
All right, perfect. And thank you, Carol. And just want to make sure, can everybody hear me okay? Yep, good. Thank you for the head nods there. I was having some trouble getting logged in, so I'm glad. Well, good afternoon. We are glad, as Carol mentioned, that we will continue being your medical provider moving into plan year 2022. There are a few things, of course, that we want to talk about over the next several minutes. We want to go over the plan benefits, programs, and features, and of course, the new Part D drug benefits that will now go through UnitedHealthcare. We also want to discuss what to expect next, and then finally, we'll review how to enroll. As we move on to the next. So the first thing we'll do, of course, is go over the Medicare plan benefits. The good thing is, as we go through this, not a lot has changed on the medical side. So we will move through those, not super quickly, but we're not going to spend too much time on that piece. We did want to just give you an overview for maybe some of you are newer to the Medicare plan, or some of you are just curious if anything has changed. The plan, of course, does provide coverage for visiting doctors, specialists, and hospitals in or out of the network for the same cost share, as long as the provider participates in Medicare and accepts the plan. That has been the case over the past several years, will continue to be the case moving forward into 2022. You do not need a referral to see a specialist. Again, there is no change in that. You are not required to use in-network providers, but your doctor may already be a part of our network. Feel free to go to our website. It is uhcretiree.com/system, or call 866-899-5903. TTY users can call 71. On to the next. Some different changes that will be taking place for 2022. Of course, I'm sure as many of you have heard, and we've received some questions already on, we will now be including the Part D prescription drug coverage in the Medicare Advantage plan automatically for both the base and enhanced plans. You will be automatically enrolled in the Part D prescription drug coverage There is no additional cost that you'll have to pay, and no further action is needed for coverage. An additional benefit that is being included in the medical for 2022, and this again is for both the base and enhanced plan, is a new benefit called Healthy at Home. And United Healthcare Healthy at Home includes 28 home delivered meals, 12 one-way rides to medically related appointments or the pharmacy, and 6 hours of in-home personal care for tasks like preparing meals, bathing, and medication reminders. These are both available after you are discharged from an inpatient or a skilled nursing setting. So once you're discharged, these benefits will become available to you. Again, that is new for 2022. We do want to note that if you're currently enrolled in the base or enhanced plans, if you do not wish to make any changes, you do not have to do anything. You will be automatically enrolled into, for instance, if you're in the base plan now, you will be enrolled into the base plan with the drug coverage in 2022. The same is true for the enhanced. So that will automatically happen. You do not need to enroll into anything. I will just add, just as a reminder, this time of year, you may have already noticed that your mailboxes will begin exploding with all kinds of advertisements from different carriers. Please be very careful what you're filling out, or if you get a phone call, what you're answering to on the phone. We've had it happen in the past where someone inadvertently signs up for a different plan. It cancels them off of this plan, and then we have to work with the university and yourselves to enroll you back into these plans. So just be very careful. You do not need to do anything if you are happy with the plan you are in today. You will be automatically moved into the Medicare Advantage plan with the drug coverage included. So to go on to the next slide. There will be a couple changes to the ID cards. These are just a couple things to keep an eye out for. If you are on the base plan, you will have a new group number. And if you look at your United Healthcare ID card, you'll see today your numbers don't line up with these, but you'll see a new group number on your 2022 ID card. And for the base plan, that group number will be 13796. And on that enhanced plan, it will be 13797. So if you get confused as to which ID card is the new one, the new group numbers will be either for the base plan 13796 or 13797 for the enhanced plan. So that is a good way for you to know you will receive those ID cards before the first of the year. To go over some of the benefits associated with the base plan and the enhanced plan, and again, I'm going to move through these somewhat swiftly only because there is no change to these medical benefits. For the base plan and the enhanced plan, there is no deductible, so that will continue to be the case. We often get the question, well, do I have to pay my Part A or Part B deductibles? The answer is no, you do not. If you go back one more slide there real quick, for the out-of-pocket maximum on the base plan, there will continue to be that $2,000 out-of-pocket maximum, whereas on the enhanced plan, you will have a $0 out-of-pocket maximum for those. And again, no changes there. Now we can go ahead and go forward. Thank you. Okay, for the base plan, again, no changes to the copay structure. Primary care provider visits will continue to have a $10 copay. Specialist office visits, $20. Urgent care, $35. Emergency room, $65. Inpatient hospitalization, $200 per admission. And outpatient surgery, $100 copay. And on the enhanced plan, you will continue to have $0 copayments for your medical services. So we can continue on. And again, those are in and out of network. Preventive services, no change here either. Annual physicals, wellness visits, immunizations, breast cancer screenings, colon cancer screenings are all included in both plans for $0. So move on from there. Some additional services, we just wanted to walk through these. Medicare covered podiatry, which includes routine foot care up to 6 visits and any medical conditions of the foot. On the base plan, a $20 copay. Medicare covered vision services, including your annual exam and any medical conditions of the eye, $20 copay. Medicare covered hearing services, including annual exam and medical conditions of the ear, will continue to have the $20 copay. And then finally, Medicare covered dental services, which relates to things such as surgery of the jaw or related structures, setting fractures of the jaw or facial bones. There's additional Medicare covered dental. It's very specific what Medicare will cover when it comes to dental services. So if you have your evidence of coverage, or if you're registered on uhcretiree.com, you can go to the website and view your evidence of coverage there for a full list. But Medicare covered dental services are $20 copay. And of course, as you can see on the enhanced plan, those are $0 copayments for all of those services. Some additional services, Medicare covered chiropractic care, which really is just manual manipulation of the spine, is a $20 copay on the base plan, $0 on the enhanced plan. There is additional routine chiropractic care, and we separate these out because one's Medicare covered versus routine, and on your benefit listing, it'll appear this way. On routine chiropractic care, you are able to get additional services such as x-rays, ultrasounds, traction, whirlpool, and some additional services that are in your evidence of coverage. On the base plan, those are 20%, and on the enhanced plans, that is $0. That is up to 12 visits per year, so you do have that. So to move on. Diabetes testing and monitoring supplies, these are included currently for OneTouch and AccuCheck blood glucose testing strips and meters. You are able to get your testing and monitoring supplies for a $0 copay. Some of those supplies include lancets, lancing device, glucose control solution, and replacement batteries. Again, this is included today, so there is no difference there. To move on to the next. So now we're going to get into, I'm sure what a lot of you have many questions about, the prescription drug plans. So I want to make sure that I stress as we get into this, we did a lot to mirror the benefits that you have today to ensure there was as little disruption as possible. So we will walk through the coverage that's included. We'll walk through the copays. I do want to direct everyone to the phone number that's listed here. There's two ways that you can go about looking up your medications. One is to go to our website, that's uhcretiree.com/UM system, and that's the landing page specific to the University of Missouri Retirees Independence. And you can then look up prescriptions on that page. You can also create your own account if you haven't already, or you can call United Healthcare Customer Service at 866-899-5903, and they'll be able to go through all of your medications with you, check them, see what tier they're going to fall under, what their copay is going to be. So again, if you have any questions related to your medications, you just want to double check, make sure that things are covered, feel free to give us a call or use the website. We do have in United Healthcare's pharmacy network, thousands of national, regional, local, and independent pharmacies, including some of the national chains, such as Walgreens, CVS, Walmart, and Mizzou pharmacies. It really is difficult nowadays to find a pharmacy that doesn't work with the larger insurance carriers. So chances are your pharmacy already takes United Healthcare. Again, you can go to the uhcretiree.com website or give us a call. We can look up those medications, look up those prescriptions, or you can on the website along with your pharmacies to make sure that they're in network. Our formulary has thousands of brand name drugs as well as prescription drugs, and there is bonus drug coverage included on top of what is standardly offered through Medicare Part D. So those are all included. So again, any questions you have on that, feel free to go to the website or give us a call. We can move on to the next page here. So coverage in the gap. So one of the questions that always comes up is, will I have coverage in the gap? Again, we tried to mirror very closely the coverage that you already had. So during your initial coverage phase, which we will talk about in the next slide as well, you will pay your normal copays. The way that Part D plans work, if you're not familiar, is that when you are in your initial coverage period, everyone receives this bucket of money, if you will, towards the purchase of medications. So starting January 1st, when the United Healthcare Part D drug plan kicks in, everyone will have this allotment. As you go throughout the year and pick up your medications, what is deducted from that is what the full cost of the drug, so both what you pay and what we pay. Once you've exhausted that $4,430, you move into the coverage gap, also known as the donut hole. Now, on standard Part D plans, and when I say standard, I mean individual plans like the ones you'll see commercials for on television. Once you enter the coverage gap, you then have to pay 25% of the cost of your medication on most plans. There are some differences out there, but very few of them provide, actually none that I've ever seen, provide full coverage through the coverage gap, meaning that your copays will not change. I do also want to add in that you do have an out-of-pocket maximum specific to your medications for $4,130. So you won't ever pay copay-wise more than that towards your prescription drugs. With that being said, once your out-of-pocket costs reach $7,050, understanding that in that out-of-pocket cost, what we calculate into that is manufacturer discounts that you don't see on the back end. That can get you to that amount. Once you reach that, you move to catastrophic coverage, where you would pay $395 for generics, $985 for brand name medications, or 5% of the cost, whichever is greater. You would stay in that for the remainder of the year. Now, I do want to say again that $4,130 out-of-pocket maximum will remain in place, and that is specific to your drug. So you do still have that protection that you're used to in that. So to move forward from here, now we'll go over some of those copays. So again, very similar to what you had previously. Tier 1, which is all covered generics, for a 31-day supply is a 20% coinsurance with a $7 minimum copay. If you're looking to have home delivery, you can get a 90-day supply for 20% coinsurance with a $15 minimum copay. Tier 2 medications for a 31-day supply, these are your preferred brands, is a 20% coinsurance with a $15 minimum copay. And for a 90-day supply through home delivery, 20% with a $30 minimum on those. And again, this is through OptumRx. That is going to be the new mail order vendor in 2020. Tier 3 medications, which are non-preferred brands, is a 50% coinsurance for a 31-day supply with a $30 minimum copay, or for mail order, a 50% coinsurance with a $60 minimum copay. And then finally, for your specialty tiers, it is a 25% coinsurance for both the 31-day supply and the 90-day supply. So to move on from there, oh, I'm sorry, if we could go back one more. I didn't want to mention one more, I apologize. Very top there, two very important notes. Prescription drug deductible, $0. That is something that is different from your previous plan or the plan that you're currently on, which today does have a deductible. So you will not have a deductible on your prescriptions in 2022. And of course, as I mentioned previously, you will continue to have that out-of-pocket maximum protection of that $4,130 towards the cost of your medications. So thank you for going back on that. We can move forward now. So now to get into some of the additional programs and features, and again, a lot of this is already in place today, so I'm not going to spend too much time just to make sure we have time for questions at the end. So to move forward, as you saw, the foreign travel benefit, this is something that's been in place now for a couple of years. This will remain for both the base and the buy-up plans. There's a $200,000 lifetime maximum travel benefit for any non-emergent medical expenses incurred outside of the U.S. Some people say, well, why would you specify non-emergent? Because the plan always included urgent coverage for any international travel for urgent care and emergency services. So that has always been a benefit, but we did work with the university to add this. I believe it was for 2019, I think, to add this benefit in. So it's just an additional benefit. So to move forward on there. This we mentioned earlier, United Healthcare Healthy at Home. So following any inpatient and skilled nursing facility discharge for up to 30 days after, you are eligible for 28 home delivered meals through Mom's Meals, 12 one-way rides to medically related appointments and the pharmacy, 6 hours of in-home personal care through Care Links. And again, that helps with tasks like preparing meals, bathing, medication reminders, and more. You do not need referrals for that. Meals and rides are only eligible to those who are referred by a United Healthcare advocate. Basically, how that works is if you're in the hospital and you have a very critical condition, when you are discharged, we will reach out to you automatically. If you do not have a critical condition, but you still have recently been in the hospital and are interested in any one of these services, you can call United Healthcare and they can go ahead and get that set up for you. And again, our number at the bottom there is 866-899-5903, TTY 711. I do just want to mention on this, this is not a one-time benefit. If you are admitted to the hospital or a skilled nursing facility multiple times throughout the year, this benefit will become available to you after each one of those discharges. So I just wanted to call that out. To move on. Annual physicals and other preventive care, again, these are included in your plan today. You can schedule your physical and your annual wellness visit together. It's better to get those earlier in the year. That way you can follow up on any preventive care. Remember, there are some incentives available to you that allow you to go ahead and earn some rewards for doing some of those preventive services. So take advantage of those. We did want to talk also, of course, big topic for the past 2 years, vaccines. If you are getting the COVID-19 vaccine, please make sure you use your Medicare red, white, and blue ID card when receiving that. The federal government is still paying for those directly. For your Part B benefits, these again are going to be through your medical benefit. Some vaccines include the flu shot, the pneumonia shot, as well as the hepatitis B shot for those who are at medium or high risk for hepatitis. Common vaccines under Part D, and again, this is your drug benefits, so just a reminder that will be under United Healthcare in 2022. The shingles vaccine, the Tdap vaccine, hepatitis A, and then hepatitis B for those at low risk for hepatitis. The benefits for these should be the same regardless of where you receive that vaccine. We have gotten that question previously, and we just wanted to stress that if for some reason you experience a difference in benefits, whether it's your Part B medical vaccine or those covered under Part D, please give us a call, United Healthcare. Your experience should be the same regardless of where you receive those vaccines. So to move on then. Some other programs, and again, these are programs that are in force today that we just wanted to highlight. House Calls, which provides that at-home visit with a United Healthcare nurse. Those will continue to be offered, and we encourage that. Renew is our health and wellness experience that's available online through the uhcretiree.com website. That just provides a lot of resources and activities. Renew Active, which is our free gym membership. That will continue to be offered and will also provide an annual personalized fitness benefit. You do need to call and get your activation code to go to a Renew Active gym. You can do that either by calling customer service or by going to uhcretiree.com. Once you register for your account, or if you already have one, you can go in there and there's a section for you to register with Renew Active. Virtual visits, of course, I know a lot of individuals were taking advantage of this, myself included, in 2020 and still into 2021. You're able to have a video chat with a doctor or behavioral health specialist, so feel free to take advantage of that. Telephonic nurse support has been and will continue to be offered 7 days a week, 24 hours a day for any medical questions you may have. And then finally, United Healthcare hearing is still included with this plan. You do want to make sure that you are using a United Healthcare hearing provider. When purchasing your hearing aids, that is how you're going to get the most savings. And that is also the way in which you're going to be able to use your $500 hearing aid allowance every 3 years. If you purchase a hearing aid outside of the United Healthcare Hearing Network, you will not be able to use that $500 hearing aid allowance. So just wanted to remind everyone of that and just review those. So to move forward. Just to go over Original Medicare's rules, you must be entitled to Medicare Part A and enrolled in Medicare Part B. We always get the question, do I have to pay my Medicare Part B premium? The answer is yes, you do. You can only be in one Medicare Advantage plan at a time. Enrolling in another plan, as I mentioned earlier, will automatically disenroll you from the plan you're currently enrolled in. It's important that you enroll in a Medicare Advantage plan, well, in this case through the university that offers the Part D coverage as well. If you do not enroll in Part D or a Medicare Advantage plan that includes drug coverage, as ours will in 2022, and you do not have other credible drug coverage somewhere else, you may be hit with Medicare's late enrollment penalty. So it's very important that you enroll in a drug plan when you are eligible. When you're a member, many of you, I'm sure, have referenced your evidence of coverage, which is available on the uhcretiree.com website. Feel free to take a look at that again for some of those other benefits, such as the dental that we talked about. That is where you get into all of the very specific benefits that are covered under some of those provisions. So feel free to take a look at that online, or you can call United Healthcare and request one. All right, to move forward from there. All right, so just what to expect next. As we mentioned, of course, we are changing plans for 2022. So some things you can expect is mid-October, you will receive a United Healthcare 2022 plan guide regarding the pharmacy and medical benefits. That is really going to be your plan guide that welcomes you to the plan. I will say, just so nobody gets nervous, that in the back of that plan guide you're going to receive, there is going to be a abridged formulary included. It's not a list, of course, of all of the medications that are covered on United Healthcare's prescription drug plan. It is simply the more commonly utilized. So I just want to make sure that when you get that book, you see the formulary and nobody gets nervous that their drugs may or may not be covered. That's really just the more commonly utilized medications. Feel free to give us a call if you don't see your prescription in there. Chances are it is covered, it's just not in that abridged version. Early December, you will receive a notice of disenrollment regarding your 2021 pharmacy benefits from Express Scripts. Don't be surprised by this. They're required to send it out. Medicare does require anytime someone is terminated that a letter be sent. So you will receive that notice from Express Scripts. It is normal. We are working very closely with the university as well as others to ensure that the enrollments for the 2022 plan are submitted appropriately. So don't be surprised when you get that. In mid-December, you will receive your new United Healthcare member ID card, along with a quick start guide with information on your medical and pharmacy benefits and how to get the most out of your plan. And this is going to be key. Starting January 1st, please make sure you are using your new United Healthcare ID card. If you continue to use your previous ID card, you may have some issues with claims, especially those pharmacy claims. So you want to make sure when you go to the pharmacy that you show them the new United Healthcare card. Otherwise, they may try to run your benefits through Express Scripts, and Express Scripts is going to say, oh, you don't have us anymore, and they're not going to pay the claim. So it's very important, starting January 1st, that you please start using that new United Healthcare ID card so your prescriptions process appropriately. After January 1st, 2022, United Healthcare will give you a call to do a health survey. This is normal, they are voluntary. You don't have to answer the questions, of course, but we certainly recommend you do. Part of that is allowing us to see what clinical programs we offer that you may be eligible for. Again, they are voluntary, but we certainly encourage you to complete those when we call. So we move on down. All right, so again, just a reminder on how to use your plan. You will continue using your United Healthcare and Express Scripts ID card for the remainder of 2021. If you get a prescription at 11:59 on December 31st, mind you, you're probably not doing that on New Year's Eve, but if you are, you'll want to use your Express Scripts card. You will have those benefits until the end of the year. Starting January 1st, use your new United Healthcare ID card for all services, medical and prescription. Provide your pharmacy with a new ID card so they don't process claims through your old Express Scripts plan. And the back of your ID card, as it does today, will have important phone numbers for you and your providers in case you need them. You will notice also we have a little sample on the bottom of the ID card here. You will see on your new United Healthcare ID card, it will have that little box where it says Medicare RX. And it'll have the RX bin and the RX PCN and RX group. That's another way that you can tell it's your new card because it'll have your prescription information on it. Those numbers, much like the card I'm sure you use today from Express Scripts, are what the pharmacy will use to process your prescriptions. So it'll look very similar to that. The group number will be different. The ID card, of course, won't be what you see here, but it'll look very similar to that ID card. So to move on. UHCretiree.com. We talk about this website very often, especially as I have over the past several minutes. Please feel free to register on this website if you haven't already. For your own accounts, you can look up claim information, review benefits, print ID cards, look up drugs. That, of course, will be new functionality in 2022 because this year, of course, you don't have that with us. You can search for doctors, explore, renew, and sign up to get your explanation of benefits online if you would like to. Let's move on from there. All right. And I believe we have a couple questions, Allison, is that right?
Yeah, we're gonna pause this and then move on to look at the PPO and retiree healthy savings plans first before we get to questions, and then we'll come back to
Okay,
that.
perfect.
But I want to remind
Right.
folks a lot of really great information that David provided related to the Medicare Advantage program. A lot of details too. So please remember that this session is being recorded and that we will provide a copy of the recording on the website shortly after this event. So don't worry if you feel like you missed something, you'll have an opportunity to go back. So now we'll move forward and have an overview of the Retiree Health PPO and Retiree Health Savings Plan for 2022. So I'm going to kick it back to David.
Perfect. Thank you. All right. So to go over those non-Medicare plan offerings, and again, we like to go over these annually. There will be two plan options continue to be offered: the Retiree Health PPO plan and the Retiree Health Savings Plan. And again, these are for non-Medicare retirees and their non-Medicare dependents. So to move forward, just to go over some of the benefits here, we will start with the Retiree Health PPO. It is going to have a deductible of $700 for an individual or $1,700 for a family. Annual out-of-pocket, $3,400 for an individual, $6,800 for a family. Primary care office visits, specialist office visits, and urgently needed care will be 30% coinsurances once the deductible is met. Inpatient hospitalization is $325 per admission, and then 30% after the deductible. And outpatient and emergency room services are 30% after the annual deductible is met. For the Retiree Health Savings Plan, oops, just to go back real quick there. For the Retiree Health Savings Plan, if you're in that one, your deductible for 2022 is going to be $1,750 for an individual or $3,500 for a family, and that again is medical and RX. Annual and out-of-pocket maximum is $3,500 for an individual or $7,000 for a family. For primary care office visits, specialist office visits, urgently needed care, inpatient hospitalization, outpatient surgery, and emergency room, it is all 15% after the annual deductible is met. All right, so to go over the prescription drug coverage for the Retiree Health PPO, there's a $75 deductible for retail only, and there is a $3,800 out-of-pocket maximum for self only. So retail copays here, your generic medications are going to be 20% with a $7 minimum copay. Preferred brands, 25% with a minimum of a $15 copay. Non-preferred brands, 50% with a minimum of $30 copays. And then for home delivery, which is your 90-day and your in-house pharmacy for 90 days as well, generic is 20% with a minimum of $15 copay. Preferred brands, 25% with a minimum of a $30 copay. And then finally, non-preferred brands, 50% with a minimum $60 copay. Prescription drug coverage will continue to be provided through Express Scripts for all enrolled retirees and dependents. Again, this is for those that are pre-65 non-Medicare. I just want to clarify that. Any help in customer service information you may need, as we mentioned, for any network or coverage questions for the Medicare eligible individuals, please give us a call at 866-899-5903, a TTY 711, 8 a.m. to 8 p.m. local time, 7 days a week. For non-Medicare eligible retirees and dependents, you can call United Healthcare at 844-634-1237, TTY 711, and that's going to be 7 a.m. to 9 p.m. Central Time, Monday through Friday. And then any questions on retiree insurance plans, all retirees can contact System HR Service Center at 573-882-2146, 8 a.m. to 12:30 p.m. and then 1:30 p.m. to 4 p.m. Central Time, Monday through Friday. Right, just to go over those important dates again, I know a lot of you are going to be wondering when are you going to be receiving things. So as we mentioned earlier, mid-October, you will receive the 2022 United Healthcare Plan Guide, which is our benefit booklet that'll have that small formulary listed in there. Our virtual education center, feel free to check that website out, is uhcvirtualretiree.com/UM system. Again, that went live about a week ago. uhcvirtualretiree.com/UM system. There's a lot of really good information on there that you can print out. It gives you additional information on the plan that is separate from our uhcretiree.com website. On October 15th, so next week, Medicare Advantages, our Medicare Advantage retiree website will be updated with 2022 plan information. And again, that is the uhcretiree.com/UM system website. Early November, around the 5th, if you're, or actually on the 5th, I'm sorry, not around, let me clarify, I don't want to get in trouble. On November 5th, if you're making a change from base to enhanced or enhanced to base, your change form is due. So make sure if you do want to make a change that you get that in no later than November 5th. In early December, you will receive a notice of disenrollment from Express Scripts. Again, expect that, it's normal, that is required to be sent out. Around December 15th, you will receive your new 2022 ID card and Quick Start Guide, which is your welcome guide. And then as we mentioned earlier, start using your new United Healthcare ID card on January 1st. We do want to note, of course, the mail, they are making some changes, so the delivery times may be different than what's listed above based on the mail. And just a reminder, if you have any questions regarding the 2022 plans, please call United Healthcare Customer Service. You have our phone number 866-899-5903. Questions on your current plan, it is the same number. Of course, remember your current plan does not include the prescriptions, so I just want to remind you of that. All right, to move forward. Right, and again, thank you. It's been a pleasure over the past several years to come and see all of you in person at some of these sessions that we've done. We're very glad to continue our relationship with the University of Missouri, as well as the retirees. We look forward to continuing to work with you. I see there are a whole bunch of questions in the Q&A box that have popped up as I've been talking. The university will, of course, direct those towards us. We will go ahead and answer those appropriately. And I think we have some questions as well to go over with Allison that may have come through. And you can skip over this slide. And this one too. There you go. All right.
Great. Well, David, thank you so much. And Carol as well, talking about information on the 2022 plans. A lot of detail and covered well. So thanks again for that. Great job. We'll address now some of the questions that were submitted ahead of time, and then please feel free to keep submitting questions. I see we have many in the Q&A box. So we'll try to get to as many of them as we can within the time constraints that we have. But again, there will be follow-up after this session as well, so please keep that in mind. I'm going to go ahead and start with the first question that came in ahead of time. So this question is for Carol, and it's about annual enrollment. So this retiree asks, how do I enroll if I don't have access to internet during the annual enrollment period? Similarly, we have someone who said that they might be out of the country during the enrollment period with no secure internet connection. If they have to make a plan change, how would somebody proceed related to internet access, Carol?
Yeah, sure, Allison, just want to make sure that my audio is working. Can you hear me? I think my audio is not working again.
We can hear you. Go ahead,
Okay,
Carol.
great. Thanks. So Allison, that person would complete the annual enrollment retiree benefits change form and return it to our HR service center, either mail, email, or fax by November 5th. And they can get that form online, or they can visit the HR service center or their campus HR team in person if they don't have internet connection. And then for the person that will be out of the country during the annual enrollment period, they can complete and submit that paperwork before they leave, even if that means submitting it before the annual enrollment period begins.
Very good. Thank you, Carol. We have another question for you, Carol, and it has to do with age and eligibility. So this person turns 65 next year, so coming up. So when should this person contact you, the benefits office, about moving from non-Medicare coverage to Medicare Advantage, and what is the process?
Sure. So for anyone who is transitioning to the University Medicare Advantage plan, they'll need to apply for traditional Medicare no earlier than 3 months before their eligibility date. That application process can be completed through the local Social Security office or online. And then University Medicare Advantage plans includes an enrollment in Part D. So when they go through that application process, they only need to enroll in Medicare Part A and B. And then as a retiree approaches their eligibility date, the university will send them an information packet regarding the Medicare Advantage plan enrollment process. That packet will include an enrollment form that they'll need to return to us, and also along with a copy of their Medicare card. And then we have more information on the process on our Medicare website, and I'm sure we can get that into the chat as well.
Very good. Thank you, Carol. We have another question, and this one is for David, our United Healthcare representative. So this retiree asks, will mail order prescriptions that have refills remaining at Express Scripts be forwarded to OptumRx, or will new prescriptions be required?
Awesome, good question. This is a really normal question when we do these types of moves. So United Healthcare does all the time work with other vendors during changes such as this. So we are working with Express Scripts to transfer those remaining refills to OptumRx when UHC is the prescription plan provider come January. So yes, we are working to get those moved over.
Very good. Thank you, David. So we have another question for you regarding prescriptions. This retiree asks, the current Express Scripts prescription coverage for the enhanced Medicare plan has an annual deductible for prescriptions obtained at a retail pharmacy, but not for those obtained by mail order. So then the question is, information on the university's website regarding the 2022 plans shows no deductible for either. Is this change correct? And then there's a follow-up question. So the follow-up question to that is, what differences should we anticipate for the cost of prescription drugs obtained through a retail pharmacy as compared to those by mail order from the new supplier?
Okay, perfect. Well, thank you for those. And those are really good questions as well. So there is a change for 2022. There is no deductible for prescriptions. I mentioned that during the presentation. So that is a change for 2022. You will not have a deductible for prescriptions regardless of where they are obtained. Additionally, when it comes to some additional changes, I should say, that you should expect is when it comes to getting a 90-day supply, you want to make sure, of course, that you have a 90-day supply prescription from your doctor. Medicare retirees will now be able to obtain that 90-day supply of prescriptions filled at a retail pharmacy for the same cost share as using the mail order. Additionally, cost shares will be the same at retail pharmacies as they are at MU pharmacies. So that's a change as well. And then finally, one additional change is all generic medications will now be listed as tier 1 medications. So a lot of good questions in there. There are some changes. We view them all as very positive changes, no longer having that deductible, not having to worry about the cost differentials depending on where you're picking up your medications. So there are some changes, and thank you for asking that question. That's a really good one.
Okay, thanks again. So I have another question, and this one is for Carol, specific to COVID-19. So Carol, will COVID-19 co-pays for testing, treatment, hospitalizations continue to be paid in 2022?
Yeah, that's a really good question. And the answer for testing is yes. COVID-19 testing and testing related services are zero cost share through the National Public Health Emergency period. And then COVID-19 treatment, such as hospitalizations, will be paid according to each plan's benefits.
Very good. Thanks again, Carol. So now we're getting to some questions that have just recently come in. This question will go to David. It's about Medicare eligible retirees. Will they still get a 90-day supply of prescription drugs from Mizzou pharmacies at the same cost as mail order? David, you're on mute.
Oh, geez. Sorry. Of course I am. Sorry about that. I'm not on my phone, but anyway. So to answer the question is yes, and we actually just went over that. So very well timed question. You will be able to obtain a 90-day supply of prescriptions at a retail pharmacy for the same cost share as using OptumRx or the mail order company. So yes.
Very good, thank you. And you can just stay tuned, David, because the rest of these questions come straight to you. So here's another one.
I have no doubt.
All right, so this is about equipment coverage for diabetic pumps. Is that allowed?
Yes, and that is something that would fall under, well, there's a couple different ways this should fall. So if it is something that's covered under your durable medical equipment benefit today, there would be no change with that whatsoever. There are some materials and some supplies that do fall within Medicare Part D drug coverage. So if you're currently getting those supplies through your Part D drug coverage, that will continue and would be covered under the United Healthcare drug plan as well. Yes.
Very good, thank you. This question is about international medical coverage for Medicare enrollees. Does it include medical evacuation?
It does, yes. So the $200,000 foreign travel benefit does include any medical services you receive. So if you have to get medically evacuated, you do have coverage under that foreign travel benefit. Yes, so you would be reimbursed for that.
Very good. And we have one final question before we do a wrap up. And again, this question is about Medicare. If I enroll in base Medicare plans rather than to buy up Medicare plans this year, would I be able to go back to the buy up plan again next year?
So I think this is maybe more a question, but I'm sure I know the answer is yes, you are able to change plans during open enrollment from year to year. So if you go from enhanced to base or base to enhanced, you can make those changes annually. Carol, if you want to confirm.
I confirm, you are right.
Perfect, good, I'm glad, good.
Confirmation is nice and agreement is good.
Yes.
So thank you for that. So again, we're coming to the very end of our time together today. I want to definitely thank our panelists and the folks that prepared for this session today. Everyone who was able to join us today, all of you, thank you so much. Again, we appreciate your engagement and ongoing support in this work. What we want to make sure that you know is that the answers to the Q&A in this video will be available after this event. It'll be online very, very shortly. We'll send a follow-up email to let you know when the content is available. So please don't forget to review your individualized benefits statement from the system that you received or will be receiving in the mail shortly. The email, that mailing includes personalized benefit options as well as your premiums. It also includes opportunities to learn more and to get one-on-one support, as well as resources you can use to make the most of the plans and the benefits that are available to you. And as always, you can review existing materials, insurance information on the system website, or if you have follow-up questions, you can always contact the HR Service Center on the screen. at hrservicecenter@umsystem.edu. So again, I want to say thank you for joining us today, and we will connect again with you soon. Have a great rest of your day, and thanks so much, everyone. Take care.